All right. Welcome to another exciting episode of Why Does Healthcare Suck? That's right. Why Does Healthcare Suck? It is our ongoing series that we do monthly, talking about a number of the issues with our healthcare system and how you can avoid some of those pitfalls and traps. Now, I came up with the concept of this because of a Harris poll that showed 70% of Americans believe that the healthcare system has failed them in some way. Well, there's no other definition then but that the healthcare system sucks. Now, it's interesting because I believe most people think that they get really good care. Now, we obviously hear of instances where they don't. It's not always, roses and celebrations and such. But overall, our healthcare system is pretty rocking. However, healthcare sucks because of the administration and so many other pieces, the difficulties. It's just so convoluted and difficult to go through. As a personal story, my mom recently had to have a pretty major surgery, and everything went so awesome. And the people at her hospital were just incredible. It was an absolute pleasure to be at the facility. It was a pleasure to see, how they interacted with her, and it was awesome. It really was. But I'll tell you what, folks. The biggest problem that we have in healthcare plans, so employers have, so most folks have, is the engagement in their health plan. Because if people don't understand what benefits that they have, how can they utilize them properly? If people are not engaged in their health care, if they're not advocating for themselves, if they don't have anyone to ask questions to or anyone that they feel comfortable asking questions to, then it becomes a huge, huge deal. And we're going to talk about that in depth today and talk about the huge importance of engagement and having your employees really understand, and you yourself understanding that health plan. We are super, super honored to have Sally Pace with us today. Sally is the CEO of Connect Healthcare Collaboration. And let me tell you, she's in all kinds of stuff too. She is going to be heading up the Validation Institute Health Benefits Nation that is coming up in September. I'm sure she'll talk more about that as well. And I am very honored to be a speaker there too. So I'll get to see her in person. I am super, super excited to introduce you to Sally Pace. Sally, welcome aboard.
Thank you, Harlan. I'm so excited to be here because, as you know, this is one of my most favorite topics. Not just the pitfalls of healthcare, but how to drive engagement so your members don't have to deal with the bad side of it.
Absolutely. Whenever I was kind of reviewing the numbers and looking at what this particular show would look like, you were absolutely the first person that came to mind, because I know that this is a fight that you fight, that the engagement is something that is super important to you. A lot of the entities that you work with and work around, that is also part of it. Now, quick origin story. I met Sally at the U-Powered conference in Miami back in 2023, and immediately she pointed me out as a troublemaker.
Kindred spirits. Kindred spirits. I can spot my kind, and I had to shush you. You're talking too loud in the hall.
It was fun though, and when I say troublemaker, she did. She saw my spirit of turning over the apple cart. So I knew I was in the right place. But between getting to know her and some of the other folks at U-Powered, I have really built some incredible relationships with a number of those folks, Sally being one of them. All right, let's jump right into this thing.
Okay.
Because one of the struggles that we have as consultants, and I know you're on a little bit different side of this, but as a consultant, if I don't know the numbers, if I don't know how engaged the employees are, and I don't have any idea what the data is telling me, because I don't even look at it, then what do I want to assume? Well, I'll put in this awesome plan. Everyone's loving it. But let me tell you, it doesn't matter how awesome the plan is. If people don't understand how it works, it's not going to be good. We implemented a plan in a group that we just knew that some of our concepts were just going to love earlier this year. After the first quarter, we looked at the numbers. Not one single person had engaged in the additional benefits that we put on, hoping that they would really enhance the plan. Not one.
Well, we can fix that. Let me tell you, before we kind of dive into that, I want to set the stage about why this even matters. Like why does employee engagement even matter? And I want to give you three different statistics. Number one, Milken Institute reports that only 12% of US adults are health literate. Those are your plan members, 12%. Medical billing is one of the leading causes of bankruptcy in the United States. So that 88%, I'm doing my math right, that doesn't understand healthcare is also getting raked over the coals with medical bills that they don't know how to navigate. And finally, this is the one that I hope the audience really pays attention to, is that the Hartford's Future of Benefits report showed that 68% of employers feel that workers underutilize available services, what you just mentioned, Harlan. And so when it comes to shifting that, what we preach all day, every day, is that you have to take a marketing approach to really drive results within the health plan. It cannot, you made our point beautifully that we, again, preach all the time. You can have the best plan in the world. They can be the best ideas. But if it's that tree in the forest, if it falls and no one hears it, did it really fall? It's the same thing. And so we work with each component of the benefit spectrum, and we can talk about that in a little bit about what we do. But we have two things that we talk about. One is the rule of 7. You have got to create you've got to create multiple messages to reach people. And it truly, if you think about your own social media behavior, you're served up these ads. We're all served up these ads multiple times before then they hit our subconscious. We don't even pay any attention to them. So if you're using your open enrollment, your benefits guide as the one tool to educate people on the thing, you are a tree falling in the forest. They've got to see it. Your employees, plan members have to see something about 4 times before they start to have some type of response. They're either going to love it or hate it. And that's okay, because that's where they can start the decision-making process. And then it's that 5th through the 7th time that they will begin to take action. So rule of 7. The other thing that we talk about are the 3 R's: reach, repetition, and relevancy. I'll go into those in a second, but is it okay if I back up and just kind of explain why we do what we do and what our role is?
Yeah, absolutely. And I want to point out, folks, this is why this is so important. One of the things that we found out from this plan when we looked at the numbers is that even though we had come up with these different things, the employer wanted to do them themselves. They didn't want us to do it. They wanted to be the one to engage with their employees. Well, we had come out with all these different ways to engage them because some things resonate with some people, kind of just what you said, right? You got to have these different ones. Well, all they did is take one thing. They just took one email and they sent that out. That's it. So they had sent it out once a month, but they didn't do any of the other things. They didn't do the push notifications. They didn't do the texting. They didn't put the signs up that we sent them they didn't do any of those things. They're like, well, everyone reads their corporate email. We made sure it come from the CEO. We had them look at that. Less than 20% were opened.
Yeah.
From the CEO. You would think, and I get it, I understand what they're thinking, is that the CEO sending this email, everyone's going to open it. No, I ain't.
Nope. No. But they are going to take a break, and if there's something in the break room, slides, a poster, they're going to see that.
They'll see that. Right. They'll see that. And I want to go back to what you said about open enrollment too. The numbers came out on how much time people spend on looking at their open enrollment, making their decision. Somewhere around 20% take less than 5 minutes. What?
For one of the most financially important decisions of their lives for themselves and their family.
And then you have the over 50%, and so you got to include that block too, but over 50% took less than 30 minutes. Once again, they're not really engaging in whatsoever. They're not looking at the information. And if they are, they probably just don't understand it well enough. The people that spent 5 hours or more was like less than 5%.
No,
but that's great, right? Those people actually get it. They're looking hard to understand their benefits. And here's the other part of it. And we know this is probably the case. The ones that are spending that extra time probably have some stuff going on, or they have something in their family with something going on. And they're trying to see how this change or this year's plan is going to impact their continuity of care.
Absolutely.
But it shouldn't be that way.
Absolutely.
When you're healthy, you should be looking at that too, because you never know what's going to happen. All right, so step back. I'm sorry. There I go. I had to go off on my rant too.
Troublemaker. You're a troublemaker. No, well, and it does. It matters, and yet I think tongue in cheek, healthcare sucking is really a reflection of people feeling hopeless, and we say that, especially with the teams that our clinical advocacy team that are working with that 20% of the population that's driving 80% of the cost, most of those members not only are sick, but they are scared, alone, and borderline broke. And they do not feel like they have, they're at the end of their rope. We have story after story. I mean, I got to speak to one of our I love getting to hear the boots on the ground stories from plan members that use our clinical advocacy services. And she told me, she said, I didn't know where else to turn. My husband, who's on the health plan, had already been to 9 different doctors, and no one could help us. Regional doctors, no one could help us. They basically just shuffled us to the next one and the next one. And she said, and then he was prescribed some medication. And so I thought, well, I'm at least going to call this resource my employer offers and ask about the medication and see if there's a better deal I can get, any interactions. And from there, she learned about this Centers of Excellence Second Opinion program that her employer offered for free, Edison Healthcare, and didn't know about it. They offered it for free. Her husband went within a matter of days. He had seen another physician, was accurately diagnosed. And you think about that's your employee. So she's not the one that's ill, but she's the one that's showing up every day, totally consumed with thinking about what her husband is going through, how it's going to, he's debilitated. He literally lost function within over a couple of months. So he couldn't work. So it's a snowball effect. And so the importance of driving engagement, of educating members is so crucial. And, you mentioned email slides, but I hope that people will also take a look at, again, these traditional marketing methods. So do you have an intranet? Do you have, video is huge. Over 80% of the US population consumes information. Now that's children too, but hey, they're future healthcare consumers. Well, they're current healthcare consumers, future healthcare payers, by way of video, because that's how people are gathering information or being taught. And COVID really exacerbated that in a good way.
Yeah. So when I was mentioning my mom being in the hospital, while I was walking down to get a cup of coffee, there was a lady pushing a big stand with a TV on top of it. And she's pushing this thing. And on the TV is a guy dressed like a doctor. And they stopped at the nurse's station, and the guy says, "I'm looking for this patient." The guy on the TV said, "I'm looking for this patient." And he's like, "Oh, that's going to be in room 243. And so she rolls him down the hall. And I'm like, okay, now I've seen it all. And so I stop and I'm talking to the nurse, and she goes, "Well, by doing this, now we can offer neurology." And there was something else, I don't remember, that we don't have on staff at this hospital.
Mm-hmm.
But when somebody has something going on that needs to be seen by this type of person to help explain what we found, we roll them in there. Like, that's cool, right? So just speaking of your virtual, look at how awesome that is. Look at what's possible. And we can't even get an employee to look at what their benefits are? Really?
It is, it is a huge chasm because there are so many incredible, innovative solutions. You think about just in the pharmacy space alone, there the the strides that have been made over the past decade in pharmacy solutions and how to make sure that your body interacts properly. But yet again, that lack of attention and focus.
I want to talk on your engagement and coming up with unique ways to engage as well. One of our largest clients, we were having a conversation with them about interacting, and they asked us kind of how do we interact as a team, and we said, well, we've come to use Slack quite a bit. And they said, well, we have a Slack channel. Can we do a Slack channel so that people can actually ask questions, live questions, whenever they have something come up with your team? Why, yes, you can. And so we implemented this Slack. It's a group of 138. And weekly, we get different questions. Sometimes like, what card do I use for this? Whatever. I mean, it's basic things. Sometimes it's like, you probably shouldn't be asking that on this channel. We'll go ahead and erase that. And we'll call you up. But it is, it's been great. It's been great. We've asked a number of other entities if they'd be interested in doing it. Not everyone's quite as technically advanced as that particular company is. And most of our groups are really small anyway. But it's just, if you can find a unique way to do it and it works, be open.
Well, Harlan, I think you're at the very core, what you're sharing that is so important is that as adults, we are not prone to ask questions on our own. We have to be given permission to ask questions because otherwise none of us want to feel dumb. We have worked too hard and gotten too far in our careers. And that's just not, it's human nature to not want to ask questions unless we are invited to ask them. And so that's where thinking about that is such an awesome example of thinking outside the box but yet using a very common way. I mean, it's interesting. We challenge brokers, consultants, HR leaders to think about their own, how do you make every other decision in your life outside of purchasing healthcare? If I want a pair of black socks and I'm going to order them from Amazon, I'm not just going to type in black sock and take the first thing that pops up. I'm going to filter it. I want to look at the reviews. How quickly can I get it? There's so much that goes into my, $5 purchase of socks. And so how do we take those concepts and filter them over into the healthcare space? And I'm fortunate to work with a team that's what drives us day in and day out. How do we help people hold down this crazy world of employee benefits to make it simple and make it interesting enough to the consumer so that they want to take those extra steps, that extra time. And it starts with looking at how you're influenced by everything else in your life.
All right. So Sally, you told me as we were getting ready for this thing that you had some statistics that would just really, shine a super bright light on what we're talking about. So let's jump into some of those numbers so we can talk even more in depth on how to avoid those particular numbers.
Okay. So let's go. I've got the three that really I think are important. The Milken Institute, about 12% of US adults being health illiterate or health literate. So the vast majority of Americans do not understand healthcare in general. So when you put together content, one of the things that the biggest mistake that consultants and employers make is this whole world of acronyms. We live them. We know what STD means, but for your average American worker who is, front lines, manufacturing, high school educated, STD is very different than what you and I think about on a day-to-day basis. So really stepping back, are you providing glossary of terms? Are you explaining? Are you spelling it out? Are you, one of the things that we encourage people to think about is using pictures. Like you can take a massively difficult concept and have a really good graphics person put it into a picture, and it becomes it crosses language barrier, education. And so that statistic is one that really should disturb people, but also give you a little bit of hope to say, I can change this. I can take my plan members and educate them by helping with very simple steps.
Let's touch on that a little bit more, because in those 12%, I wonder if they really are literate. I say that kind of tongue in cheek, because probably some of that 88% know more than they think they do. But as you talk about, the terminology is so confusing, they're just not sure. You made a joke with STD. Well, let me tell you the one that I always use, and that is POS. So we have these new plans now that are POSs, and I'm like, and it don't stand well, maybe it does stand for what you think it does, but in this case, that's not what they're saying. It stands for what anyway. But it is kind of interesting, this terminology. A couple of months ago on our Why Does Healthcare Suck, we talked to Doug Geinzer, and our whole show was about crazy terminology that we use, the geek speak, that
love
us as
that.
consultants and us in our industry think it makes us look so smart. Oh, look at me, I know all these terms and all these acronyms. But I promise your client doesn't think you're smart because of that. In fact, you're confusing them even more, and you're doing them, more importantly, you're doing them a disservice, because you're contributing to that illiteracy and the complication of healthcare. You've got to make it understandable. You've got to make sure someone knows. And there's new terms added in all the time. Whenever I got into this industry, there was co-pays and there was deductibles. Now there's co-insurance and shares. And let's just go down all the different things that people just don't. Wait, what? What does that even mean? What is it? What's a max? What's a MOOP? Well, that's your max out of pocket.
Well, and what's a MERP?
I feel kind of like a MOOP for signing up for this plan is what I feel like. And so when you don't explain things well and people don't understand what they're getting, is it any wonder why we're in this illiteracy? Is it any wonder why they only take 5 minutes? They don't care. They throw a dart, or they simply choose the cheapest plan because I can't tell the difference.
Exactly. The best thing that anyone listening can do is to go and find themselves a middle schooler, and borrow one. If you have one at home, use them and ask them when you're trying to explain these difficult terms. A middle schooler is old enough to get high level concepts, but young enough to say, I don't, that tell me more, or what does that mean? They're not embarrassed to ask questions. And if you can describe whatever the thing is, biosimilars or, whatever it is, in a way that they can understand it, then you're onto something. Then you can go back to your population and put those pieces together and put it in front of them. And that's really the only way that we're going to move the needle on helping to educate employees for that.
If you're working with that middle schooler, then too, they're also not afraid to laugh at you and laugh and point at you and make fun of you. And I feel like sometimes that's kind of the looks that you get when you're at one of those enrollment meetings as well. So, but the adults don't actually do it. The middle schoolers will have no filter. So,
exactly. And then I want to bookend the statistics that I shared. I want to go to the one that is the Hartford's report on future benefits, talking about of the employers that participated, 68% of them feel that workers are underutilizing available services. And Harlan, you opened the show with a story about it. And that's where I say, you know what, the onus is on all of us as leaders in this industry to find ways to drive engagement. And you touched a little bit on data. And that's something where on our advocacy side, whether it's benefits advocacy or clinical advocacy, like enrollment and onboarding or clinical advocacy, you've got to start with data. You as an employer can partner with your consultant to get some type of data to figure out who's participating and who's not. And then you need to go after the folks that are not participating, that are eligible for these different programs, like you are their last hope, because in many instances you are. And
You are.
and so we, like for us, we have a platform that we use that shows us, it's called members of interest. Who are the members that are not taking advantage of the services that are available to them? And by doing that, we're able to drive engagement between 50% up to 200% of eligible members, not the fluff numbers that you see, like we touched 100% of the population, but looking at actual eligible members and moving the needle on those. But you've got to start with data. You've got to ask for data. And that matters.
It absolutely does. All right, I want to jump into what I believe is the most important part of the engagement. Maybe you have a different opinion, and that's okay. I shared with you that I was blessed to be asked by Becker's Payers to talk about what we're doing in the second half of the year. What was our priorities? And the reason for that is actually I've been asked to speak at their fall roundtable. So I'll be in Chicago getting to speak at the Becker's roundtable in Chicago in the first week of November. So every month they're asking us a certain question. And then this morning, that particular thing was actually released. I shared it with you, and I didn't even have any idea today it was going to be released. So it's actually kind of cool, because all of a sudden I got the email from them saying, "Hey, here's the actual article." So here is what I said, and I'm going to give you this blurb because it gives you a context on what our focus is, but not just about what our focus is, why we're focusing on that. And so in the article, I say our number one focus for the second half of 2024 is member engagement, particularly highlighting the benefits of primary care. We believe that a strong foundation in primary care is essential for improving overall health outcomes, reducing healthcare costs, and enhancing the quality of life of our members. By actively engaging our members, we aim to foster a deeper connection between patients and their primary care providers, which is critical for preventative care, early diagnosis, and the effective management of chronic diseases. There's more of it. I'm not going to get into the rest of it. If you want to go out and read the article, I'll certainly have it in the comments, and it will be on Becker's site as well. But we include direct primary care in virtually everything that we offer, both in-person direct primary care and in many cases virtual as well. Or if they're in a desert, then we'll just have the virtual part of that. But what drove us to really go that is, first of all, we wanted people to get the care that they deserve. Direct primary care and advanced primary care is an awesome way to do that. But the numbers also show that most people don't get the primary care that they need. 61% of Americans don't go to the doctor unless they're sick. Well, if that's the case, then you're going to get worse and worse and worse before you finally go and see that doctor. And why are you seeing them now? The other number that startled me is once again, you got to have the data to know what you're doing, right? You got to have the data to know if it's impacting, you're getting the right thing. One of the partners that we started with in August of last year that provides these services, we have a few hundred people at that particular DPC. And when we got the data 6 months into it, we got the 3-month data, but that 3 months ain't enough to really judge. 6 months may not be either, but the number that stuck out to me the most, and this was the number that, man, I said, we got this thing going on. This is right. 29% of the people that had visited the facility, when asked what they would have done if they didn't have this membership, said nothing. They said nothing. They wouldn't have gone to the ER. They wouldn't have gone to an urgent care. They wouldn't have gone to another primary care physician. They would have done nothing. So that's 29% of the clientele that were now getting access to healthcare that they did not get it and didn't feel comfortable getting it before. And I said, hallelujah, we're doing something right.
Absolutely. Absolutely. But that shot, I guess we're not looking at the data exactly that same way, because we're not asking that very important question, which is such a great question to ask. That is a fabulous temperature taking question for anything that somebody plugs in. But I would say the flip side of that shows up on the health plan in real dollars are those avoidable ER visits, ED visits.
Right.
And that both of those, what you just shared and what we see in the data, have a significant financial impact on the bottom line of the plan. Uh-oh. Can you hear me?
Yeah, you're a little jittery there, but I think
Can
you're
you hear
coming
me?
back. So yeah, I hear you now, Sally. You there?
Okay.
All right.
I'm
Okay.
here. I was
And,
saying both of those have a financial impact on the bottom line.
right. And that's, of course, that's the reason why we put direct primary care and advanced primary care in there. Is anything that happens in that doesn't go towards the bottom line of the plan, because that's the membership piece of it, that all of those services, they stay away. And if you give people that access, it doesn't get worse. While there was a good number, it was like 17% that said they would have went to the ER instead. That number wasn't, well, that's of course a huge savings. That number wasn't as important to me as the other number of people that said I would have done nothing. Because while some of them may not have had a big deal, right? Maybe they were just going to be fine anyway. There's going to be a huge number of that percentage that ended up having things worse, that ended up in the ER, or ended up that now they caught a chronic condition. Now they found something there and they can now start getting that treatment. So that's what was huge to me, is now we're changing the dynamic of that group. We're helping them build that relationship with primary care that they may not have had in a long time because of the huge waits to see a doctor. Because, when you call your doctor and say, I'm sick, doc, I need to come in, they're like, we got you down for 2 weeks.
Yep.
Well, I'm going to be dead or well by then, so really don't make any difference. I'll just head over to the ER. Well, that's what we would recommend. Stop recommending people go to the ER if they're not, in a life threatening situation. ER is
Right.
not the place for you.
No, it can create so many more problems. But
Yeah.
a lot of us in our circles talk about the 20% that drives 80% of the cost.
Right.
And to your point about primary care allows that I hate to use it, ticking time bomb, the person that is going to for sure be in that 20% that's going to drive 80% of the cost, by not mandating, but offering in such a way that it's appealing and readily available primary care. You are able to kind of start to stratify your members and say, you know what, these are the folks in the plan that weren't showing up before, that really do need a lot of help. They do need attention, and they clearly didn't know what to do before. So those are the ones, now you've got your call list, your members of interest list, to be able to say, I need to help Mr. Smith or Ms. Johnston, really guide her on her health journey. To your point, 100% of the population doesn't need somebody to be there for them all the time. But if you can identify that 20% that does, you can make such a difference in their lives and in the life of the plan.
And I want to step back on what you just said there. They don't need somebody looking at them all the time, but they need to know that someone's there if they need them. And that is a huge disconnect. And that's why 61% of people don't go until they're sick. Because if I'm feeling just a little bit, or I'm kind of wondering, or I'm not getting my regular annual care, I don't go till I'm sick. And while I might not need care all the time, this is why, you look at what has happened since COVID. So even the people that normally did go to the doctor annually, they didn't go then. They weren't getting their regular checkups. They weren't getting their colonoscopies. They weren't getting all this stuff. And now we've had this huge explosion of advanced cancers and conditions that people are finding, that now they're having to take major treatment methods and high level medications, all of these things, because people that were actually doing the right thing stopped doing the right thing and maybe never started again until they started feeling wrong.
Yeah. Well, yes, that delay in care is real, and it's just now starting to show up in hard dollars on the health plan. and it's scary. That kind of goes back to what we call the 3 R's: the reach, the repetition, and the relevancy. And I want to talk specifically about relevancy, because
Yeah.
if you have access to data and you are using data, I love you, Harlan, and I love Kelly, but I probably don't need to target you for maternal care. Well, because my guess is you're not planning on getting pregnant anytime soon. But I could target my 26-year-old male and female employees that are kind of that, family planning stage. And really, when you don't have, in other words, you don't have to be all things to all people and tell all the things to all the people. If you can use your data to really hone in on the solutions that you've brought to the table. Do you have, if you have family planning services, if you've got, prevention, financial planning tools, somebody that's, they're thinking about retiring, and whatever it is, when you start to look at your population in terms of the slices of the benefits you're offering and make them relevant to those people, you can really move the needle. That's where people do start to pay attention, because it's the what's in it for me. If I know that you're serving me information that matters to just me, I'm going to pay attention. Now, the primary care and advanced primary care, that's for everyone. That's a huge deal. But when we start to look at other pockets of the plan, you really need to think about relevancy and who within your population needs to have this information.
Yeah, I agree with you. I'm going to touch one more thing on primary care, because if you're not making sure that primary care is front and center and everything's kind of built around primary care on your plan, you're not going to have better control of your cost. Now, primary care typically is not the big driver. That's not going to be the big cost of your plan. But what it's going to do is keep those big costs from your plan, because the conditions are not going to get worse, and people are going to avoid hospitalizations, ER visits, and other things like that. So I'm going to jump off of the primary care right now, although that's my very favorite subject, and I want people to make sure that we spend probably more time engaging people in our plans about primary care than we do anything else, because we feel like that is the best bang for anybody's buck, is that. But right now,
Absolutely.
we have 7 billion point solutions available to people out there. We have everything in the world that possibly could be tagged on or run alongside of a plan. I was at a conference in Houston the other day, and someone told me that they had 70 point solutions along with their health plan that they offered to their employees, and none of them had very good engagement or participation.
Shocking.
Not engagement, participation. Yeah, exactly. Shocking, right? How could they differentiate any of those? So the question I have for you is, what are you seeing right now? Because I'm going to talk about the disconnect between HR and employees here in a couple of minutes. But what are you seeing? What are the numbers telling you that employees, not employers, not HR, that employees actually want as a benefit and are utilizing right now? Not some pie in the sky thing that's out there, not somebody from a vendor telling you you need to have this, but what are you seeing, Sally?
Absolutely. Well, point solution fatigue is real. It's real, I think, on the consultant side, because they're inundated day in, day out with the next best thing. And to your point, down to the employee level, you give them too many choices. It's like, the Chinese buffet or the Chinese menu that has 3 different pages of stir fries to choose from. It's overwhelming. What we're seeing, oddly enough, is this shift away from just straight technology. I think everyone clung to technology during COVID. And even, I joke about QR codes are great as a tool to use for communication. Even my parents learned how to use a QR code instead of paper menus during the days of COVID and all that we had to adjust to. But people went so heavy on the app side because it was a quick fix, that now what we're really starting to see is this shift towards engagement with people. So we're talking about like advocacy, clinical advocacy, because people want a person to talk. They don't want a bot. They don't want, some chat thing to start the conversation. No one, this is why, like, we joke about the Blue Cross Blue Shield hotlines get terrible ratings, because when you are diagnosed with cancer, you're not going to, jump online and start chatting on, or are you going to, call it a random 800 number to discuss this very personal diagnosis? So this mix of technology and people, platforms and people, that's the biggest, giving in-person enrollments, giving a benefits guide, meaning a person, an advisor that can walk through that plan and help make wise decisions. There's very much this shift. And it probably is partially due to we were all isolated for so long. And for those of us, especially Harlan and me, that are social, that, want that engagement, it's more natural. But even anyone, we're seeing this move from just technology-based, just platform-based, to a mix of platform and people. So not necessarily a thing, that varies audience to audience, plan to plan.
Yeah.
Do you want, are you going to go international drug sourcing with this one and, pharmacogenomics with this other one? There are so many different solutions you can plug in, but you've got to be careful that you're not, one, point solution fatigue, and that you're also mixing it with people to guide your people to the right solutions. Is it okay that I answered it like that?
No, you answered it very well. And I want to tell everyone out there why it's so important that you're the center of this as the consultant. Or if you're working with someone like Sally, who's doing some of the engagement and enrollment, whoever you've got going on, why all this is important. A study that came out here a couple of weeks ago that was focused on HR said 85% of employees do not trust HR. They will not talk to them. They will not bring issues to them because they feel there could be that they'll be singled out and that there could be blowback on them, that they could be negatively impacted in their job. So when we turn to HR and give all the information to them and say, these are the folks that are then going to make sure everyone is educated and answer questions, they're not going to do it. They're not going to. If you're not involved, if you don't have an advocacy team for them, if you don't have a number, best if it's one number, if you don't have a number for someone to call when they have questions, that's not HR, your engagement's going to be terrible. People are not going to understand their plan. It's just a long time. I'm not saying anyone that HR people are bad, but in the employee's mind, they are, and that's all that matters. That's really all that matters.
Well, and Harlan, nobody that, that's also the same group that navigates the salary increases with your manager. And so I sure don't necessarily want you to know that I'm having a mental breakdown right now, because that's going to impact my paycheck at some point. Not that I have a mental breakdown all the time. If you know me, you know. But I mean, that you have to think about what that trust. And we talk a lot. We have lots of phrases but trust equals influence, and people have to trust you to be able to influence them. And you just shared a statistic that is mind blowing, but it's real, and you got to do something about it.
Yeah. All right. So we have a comment here or a question from Jim Turner. And I'm sorry I didn't see it till now. I thought this thing was going to automatically update, Jim, but it did not. But if you're still around, hopefully you're still on. So the question is, how do you get the message across to the employees about their real dollars, their real healthcare costs, and the impact on their finances? So let me kind of unpack that a little bit and see if I understand what they're talking about here. Mm-hmm. So one of the misconceptions that I believe, well, it's not that I believe, but we know this is actually true, is that in a traditional setting plan, without education, when an employee has a insurance card, I don't care which one it is, Blue Cross, Humana, Aetna, it doesn't matter. That is, in their mind, it is an unlimited debit card or an unlimited credit card. 100%. They may know what their out of pocket is, or they may know what their deductible is, but they don't know anything else. They have no idea how this impacts the company. This, in my opinion, is where advocacy shines, because if they were to call the advocate first, they can explain to them the impact of what's happening and why, if you go down this pathway and use your unlimited debit card, stop wondering, and you're spending hundreds of thousands of dollars or even tens of thousands of dollars, stop wondering why you're not getting a salary increase each year. Because Blue Cross is getting your salary increase. That's who's getting it. Blue Cross is getting your salary increase, or Aetna's getting your salary increase. You're not getting it because you are not being fiduciary of your own self, of your own healthcare journey. And when you're not, the health plan suffers, and you then suffer in turn. And Jim says we're right on target. Absolutely. So that's where we're going with this one.
Good. So I'll tell you, a couple of things. Yeah, a couple of things on that. All of us, well, maybe you have had the good fortune of never having to buckle down and look at finances in your own family, but I'm guessing that most of the people participating have. And you need to approach healthcare spend with your employees the same way that you would your family finances. Have honest conversations. If you've got an overwhelming number of diabetic folks, population, and you know that you're spending, let's call it $35,000 a year on average for diabetes management, and you're not conveying that to the plan members, and there are ways to do it. I'm not saying just cold put it out there, but there's not an employee on the planet who would like to be educated in a way to save themselves money and save their company money, because that will come back to them typically in new computers, pay increase. Your point about spend. Most employers, if they have folks that travel, have a per diem. You can spend X number of dollars on the flight, hotel, and this many dollars on meals. Treat your healthcare the same way. Talk through what it means. And one of the biggest tricks that we use, and again, this is a little marketing tip for everyone, drug spend. Most employees, most plan members have no clue how to navigate the actual pharmacy system. When you've got a preferred pharmacy list, especially if you're using a transparent PBM, do this. In wherever you're posting information about pharmacy, put the logos of the pharmacies that you want your employees to go to, because it is a mental mind trick where they start to see where they're supposed to go. And if they see, let's call it, Bartlett Pharmacy or Costco, and they don't see Walgreens, they subconsciously start to understand, I'm not supposed to go to Walgreens. They're going to rate me over the call. Then you can actually educate them and talk about how, not to beat Walgreens up too much, but they are the most expensive pharmacy on the planet. And so you can use these tricks to really educate employees without having to go real deep. There. I
want to touch on that real quick. So this is funny you say that, because I've had employees then tell me, well, that's where I get my prescriptions at Walgreens now, and they're free. No, they're not. They're not free. They're free to you, but they're not free to the plan. So let me show you some numbers, Mr. Employee, right? And it's like, well, that's where I've always went. Okay, I get it. I understand. But this is one of the fights that we have, because if they don't take any financial responsibility, just like what you're talking about, Jim, if you're not really explaining what the real dollars are, they don't feel, they almost feel like they deserve to get that. This is the big fight on weight loss medications, right? This is the big fight on all of those GLP-1s, is people say it better be covered by my plan. And people are leaving jobs and going to work at other places because certain companies have chose to cover them and they haven't. They have no idea what the cost is. None.
Absolutely. No. And this is where, as consultants, you can do something about helping these employers not be penny wise and pound foolish, because it would, I would dare say, be worth, let's call it investing in a $1,500 video that's an explainer video about the true cost of drugs that is put on that company's intranet or run in the break room or sent out in a company newsletter to save hundreds of thousands of dollars on unnecessary drug spend down the road.
I was at that conference in Houston. It was mostly employers that were there. I was not a speaker, luckily for them, because I was coming out of my seat half the time. Oh my gosh, I cannot believe that you would make this decision. And
that's their loss.
A lot of it, they did. They talked about GLPs a lot. They talked about not just them, but other medications that they have chose to cover, and they're not doing any type of alternative sourcing of those either. So they're just paying the high price. And of course, they're working with the PBMs that 80% of people work with. And, it's so interesting to me that in other words, my point is, even when they know it's the wrong thing to do and they know it's driving up the cost of the health plan, they're doing it anyway. I don't know what we can do about that. I don't know until the employer then, we had a session. Chris Deacon was there, and there was a session there that was talking about your fiduciary responsibility. If you're still getting it from one of those PBMs and you're paying this high amount, you are not being fiduciary of your plan or your people. And the lawsuits, they are coming. Those sharks are circling right now looking for any employee that wants to file a suit against their company. And without proper engagement, explaining all of these things and why the decisions are made and not including the employee in some of these things, this is what you're setting yourself up for.
Absolutely. I mean, you're right. You look at like these, Morgan and Morgan type law firms, and they're hiring attorneys that are focused on that very thing. That's one of the fastest growing areas in the plaintiff's attorney world. So it's coming and it is real. And, it's kind of I think that we're in that wait and see stage where employers who aren't properly educated don't have a clue what's going on. Their consultants have not really educated them. The ones that maybe are kind of skirting the system are just waiting to see if they hope and pray that they don't get called or they don't get tapped because one of their employees. But that's not, you haven't built your businesses on that. And so it is real. It is coming. And I think, the only way that that's going to change is I encourage everyone that's dialing in right now, that's paying attention to this, to find, just share. You don't have to create your own new content, but the more that we collectively share information, a great article that is posted, Harlon just mentioned one that he's part of today. You share these things about transparency, about how to change the concepts that have been traditionally deployed for employers. It will catch on. I do believe that the American public is smart. We're scrappy. We want to be winners. We want to succeed. None of us want to be played for fools. And so let's help people see how to move the needle, how to move away from this traditional model and go towards this innovation, this, mixed great solutions mixed with great people.
Yeah. So Jim's made another comment. I just want to let everyone know, if you type in the comments now, they should show up on this. So whatever platform that you're watching this on, because we are across multiple platforms, if you have a comment or a question, please put that out there. We've got just a few more minutes. So Jim's comment is, what would happen? This is pretty funny too, Jim. I like this. What would happen if the employees were paid in full and then every Friday had to hand over the money for their health plan? Well, that'd wake them up. That would wake them up. Unfortunately, I think what would really happen in that case, Jim, is they would all leave that company that was doing that because it would freak them out so bad they'd have to go somewhere else. Because that is certainly making them be accountable for what they're spending. But boy.
But we do still, I mean, not to that extreme, although I like a good challenge like that. So thank you, Jim. But we definitely see groups that either incentivize, or what's the opposite of incentivize? Not punish, but decentivize employees. making poor,
carrot and the stick.
yes,
Yeah.
exactly, for making poor decisions, because it is, and I'm, the whole Publishers Clearinghouse check thing, but again, human nature is we want to be winners. We want to rally towards something that's for the greater good of all of us. And so, consider setting goals for your plan members, not weight loss goals or anything like that, but talk about, cost containment. Have honest conversations. You have honest conversations with them when the budget is down and you can't give pay raises. Do the same here. And then but on the flip side, don't forget to tell them what they accomplished.
Yeah, but it is. You're right.
Absolutely.
That's a great piece of advice, Sally, because it is the same conversation. Instead of just telling everyone, well, we're having to raise the deductible on the health plan again this year, or we're having to raise the copays, or we're changing to another company. No one explains to them why. No one has any idea why. They really think it's because the company is cheap or the company is trying to save their own money. They don't realize that it's their money too. It's your money. It's coming out of your check. You've got some skin in the game. And even if their company's paying 100%, it's still the rate. You're not getting those raises. You're not getting that new technology. You're not getting that thing because of poor decisions that you're making and lack of engagement. And it's your money.
Absolutely. We work with a hospital system on enrollment and new employee onboarding. And we heard story after story a couple of years ago from employees because they had shifted the plan. And obviously they want to drive traffic to their own hospital system. But it's free for their employees to go there. And what we heard feedback from the employees over and over was nobody's ever really explained why they wanted us to go to our own health system. We just assumed it's so that they could have data, information on me and my health conditions. Like basically you're going to weed out the sick people and keep the healthy ones. It took sitting down and saying, this is a cost savings for you and a cost savings for them by keeping you here in this hospital system where there's exceptional care. And we promise you, nobody's pulling up charts and looking at what employee went to what doctor yesterday. That's just not, your leadership is too busy for that. They're trying to keep the doors open of the hospital. But just by simply explaining, it's kind of as parents, we talk about with our children that if you do this, then this will happen. If you disobey me, then I will take your iPad away. But if you are polite and, don't get in trouble this week at school or make an A, then I will reward you with whatever, ice cream, money, whatever. It's the same thing with employees and their health plan.
All right. So I really appreciate everything that you brought to the table. We're just about out of time, but what I really want you to dive into on your side, Sally, is what y'all do. I mean, you got a whole lot of stuff that y'all bring to the table, but kind of go into some of the different things you do. And then I also want you to touch on Health Benefits Nation in Nashville.
Absolutely. Absolutely. So Connect Healthcare Collaboration, or CHC. We know it's a mouthful. The words were intentional. We love to be collaborators and connectors. We're at our core an employee benefits marketing firm. What does that mean? Well, you think about this crazy world that all of us live in, and you've got essentially four different players: point solutions, brokers, consultants, employers, and then employees. We want to touch every spectrum of that to help move the needle ultimately on employee engagement and outcomes. So we help point solutions with benefits marketing themselves to those different audiences. We then help employers drive the needle with their employees with enrollment and onboarding services. Then we say our nurses are the best, marketing mouthpiece you can deploy on the clinical advocacy side to help that 20% that's driving 80% of the cost. And then those are all very high touch. Our fourth business line is, and the granite list does for the point solution arena, being, pinged every 2 seconds with vendors who want to get on your calendar. We've built a solution for that. You can do your due diligence before you take the call. Health Benefit Nation. I am so excited about this because this really is a subset of a conference that was just held in DC called Think 360. It is a time where there will be segmented out for consultants and benefits leaders to come together September 6th through 8th in Nashville. I have, if you're one of those two categories, and it's going to be 3 days of way beneficial information from hearing from your peers.
Thank you so very much, Sally. That, I'm telling you, I'm really looking forward to that event. I think it's going to be incredible. The me notwithstanding, the other speakers, it's an incredible list of speakers that are going to be there. So it is. Whenever I saw the other folks, I'm like, well, I'm going to apply, but I ain't going to get accepted with this group, man. So anyway, maybe you put in a good word for me. So I appreciate that because it is incredible. Whether you are an employer, whether you are an advisor, you're a point solution, I don't care where you are in the ecosystem, this is going to be the place to be during those dates, during the 6th through the 8th of September, because, man, it is jam-packed with some incredible information.
Yes.
All right, folks, we are a little bit over time, but we do appreciate you being with us. Most of all, I appreciate you, Sally, for being with us and sharing your incredible knowledge about employee engagement. Folks, don't hesitate to go out. You can, of course, connect with Sally on LinkedIn or some of the other platforms, and then you go out and look for it, Connect Healthcare Collaboration, and look at the services they provide. If you're having trouble with engagement, Sally is the lady to talk to get that fixed. Thank you again, Sally. Any closing comments?
Well, I want to leave with a note of hope. We joked at the beginning about healthcare does suck, but we all can change that. And I want to help anyone that needs help doing that. So thank you, Harlan. Thank you for all you do.
All right. Thank you very much. And Jim said, thanks, Harlan and Sally. Great job. So there you go. Go off on your Friday now, Sally, knowing that we're Jim Turner approved. All right, gang. Thank you so much for being with us. We'll catch you next month on Why Does Healthcare Suck? Don't forget to check out the different podcasts that I do on the Health and Wealth Power Hour. This episode of Why Does Healthcare Suck will actually be turned into a Health and Wealth Power Hour podcast as well. So if you were not able to catch this live or you don't want to watch the repeat, you can catch it when it comes out as a Health and Wealth Power Hour podcast as well. And then remember, every Monday, when I can and I'm in town, and sometimes that's getting more and more difficult, I help you start out your week with a kickstart, 10 a.m. Central Time on every Monday, where we talk about the trends and news going on in our crazy healthcare and health insurance industry. Thanks a lot for being with us, and we'll catch you next time on Why Does Healthcare Suck? We are out of here.
Thanks.